Yes, yes. Welcome, welcome, one and all. Today is Wednesday, August 23rd, 11 a.m. My name is Benyamin Levy. I'm a financial advisor here in an educational seminar today titled Medicare Basics. We're here and a few more minutes for people to join in, and we'll get started. Thank you again for joining us. Right. Wonderful, wonderful. Thank you once again, one and all, for joining us here today. And we are going to get started here. I see Uriel Reuven is present. Are you there, sir? Don't feel like, all right. Okay. All right. You can speak if you prefer. We will be muting the mics here just a minute. Bringing up the presentation. Don Oriol, are you there, sir? Okay, for the purposes of those that are on time, and I appreciate those that do value the time, and we are going to get started here. This is being recorded, so for those that may miss a portion of this presentation, they will be able to replay it. And also, for those that are present, respecting of time, will not take long, but I want to make sure that we cover all the bases here. Again, my name is Benyamin Levy. I am a financial advisor here bringing an important topic that's very dear to the hearts of many of the elderly in our community. I wanted to bring these basic rules, if you will, related to Medicare, which is your health insurance or your health. Your health is your wealth. It's very important that we have a good understanding of how the insurance world works when it comes to your health. And so Medicare is a dear one to the elderly. So let us jump right in. Again, I am an independent Medicare agent, and I want to explain how that's different from other forms of agents. One, being an independent, I have access to a number of carriers. So I'm not just locked into one carrier, okay, which can be very, very, very important, and a distinction that you have the ability to, again, access to the best, if you want to say it that way, or the one that's available to you, not just looking at one particular carrier. The insurance pays me directly, so there is no fees paid to me for services. Any transactions that are done, I deal directly with the insurance carriers. The rates are the same, whether you work for me or not. It is exactly the same. All right. And my job is simply to help provide you with the best plan type and company for you. All right. So call to review your options during the AEP period, which we'll get into in a minute, what that actually means, which is the annual enrollment period. Okay. So with that said, let's jump right in again. And what we have here, when we enroll in Medicare Parts A and B, when you first turn 65, the first month of your 65th birthday, you can enroll up to 3 months before and after. Birthday falls on the first of the month, then it's the first of the previous month. Typically, it's an auto enrollment. If you're receiving Social Security payments, you are automatically enrolled in Medicare Parts A and B. There is a Part B premium, which is $170.10. That usually comes directly out of your Social Security check, but you are paying that premium. When should you enroll in the Medicare Parts A and B? If you don't have Social Security, then it's a manual process. You will simply just either go and set an appointment at your local Social Security's office and enroll. All right. And simply they will bill you for your Part B premium on a quarterly basis. Medicare when working. For many that are continuously working, they haven't retired yet, and they have begun, if you will, to receive their insurance benefits and do not enroll in Part B. That's a frequent case. Because why? They're actively working and they have coverage through their job or through their spouse that may be working. Now, it's important to note you must meet both requirements to waive Part B enrollment. You must have coverage through a group of 20 or more. Medicare is the primary for groups of 20 or less. An important distinction here also, COBRA or veteran benefits are not a waiver for Part B. Some negative stuff. Part B penalties. If you don't have a valid reason for not signing up to Part B, there is a 10% penalty of your Part B premium per year. Income-related monthly adjustment amounts. People who have a higher income may pay more for Part B and D based on your income from the 2 prior years. Married couples' income are combined to determine their income-related monthly adjustment amount, and this can be appealed if you have a life-changing event. Some other negative stuff. Part D needs to have D coverage when you first become eligible. D stands for drugs or prescriptions. The government expects you to have coverage, at least Part D, even if you're not taking medication. And remember, COBRA is not a waiver for Part D. any other credible coverage, you're fine. If you don't, there is a 1% monthly penalty based on the national benchmark premium for every month you do not have Part D coverage. And you will pay the penalty when you finally do enroll in Part D. So it's incumbent upon you, I would say, to enroll immediately when you become 65 or eligible for Medicare to get Part D to avoid those penalties. Okay. So now let's get into the parts. And talk about Medicare, there are 4 parts. Going to go through each of them. The first one to be aware of is called the Part A, which is the basics. A, what is that? For most people, there is no premium for Part A. If you've been working in America for over 40 quarters, you will entitled to Part A, and there is no premium. What does Part A cover? It covers your hospital visits. If you're inpatient, you're covered under Part A. If you go to a skilled nursing facility, it covers that. Hospice is covered under Part A. Inpatient rehab is covered under Part A. Now, Part A, for some healthcare costs and some other healthcare needs that you may have, there is a deductible of $1,556 as of 2022. So there are deductibles involved. And what is a deductible? That's the portion that you pay before the insurance kicks in. All right, so make that note that you would be responsible for $1,556 right off the bat if you should go into the hospital. Okay. Part B, what is that? All right. Part B covers your doctor's visits outside of the hospital. So that's not the doctors in the hospital. This is specifically for when you go to a doctor in their office. So this is out of the hospital, outpatients, okay? And certain home health services are covered in there. Medical equipment, that's the DME that you may be receiving. Some people take oxygen or other equipment they may use for their health. That's also part of Part B. Now, most medical services outside of the hospital is also covered. Now, there is a premium that everybody pays, okay? There's no exceptions for Part B. Part B, the premium is currently $170.10, okay? Again, that is paid on a quarterly basis if it's taken out of your Social Security check, but that is the premium. There's also a deductible, again, of $233 for Part B services. Again, the deductible is the amount that you pay before the insurance pays. And with Part B, there is a 20% co-insurance for any expenses that you incur when you go to the doctors, and again, outside. So keep that in mind. That is what Part B covers. Okay. So options here. Medicare, as you just saw, does not cover medication, original Medicare, except for, Part B drugs. Also, there's a 20% gap, if you will, that you are responsible for that Part B doesn't cover. So the question is, how do you cover your Part A deductible we talked about, the $1,556, and how do you get drugs or prescriptions covered? Very important. There are 2 options. All right, write them down. Option 1, you can maintain original Medicare, all right, as your primary insurance, and buy a supplement plan, or known as a Medigap plan. Okay, it was very popular. And buy a standalone Part D plan, which is PDP, to cover your prescriptions. So that's option one. Option two, which is also very popular, you can buy an Advantage plan. You probably see a lot of those ads and commercials for Advantage plans on TV. Supplement plans, they don't advertise, just so you know. The difference with an Advantage plan is that it replaces your original Medicare. It's similar to a group or individual health plan. Okay, now let's take a closer look at what that is. Okay, and as we go through, you can put comments in the chat or questions, and I will be sure to answer them at the end if you have questions. So Medicare Basics, as we talked about, after you enroll in Original Medicare, Parts A and B, that's it. And what is Part A? It pays for your hospital stay and inpatient care. And Part B pays for your doctor's visits out of the hospital or outpatient care. And you will receive one of these red, white, and blue cards. It has your name on it. That have a unique, what they call Medicare provider ID number. And it'll tell you when your Part A and Part B dates started. Once you have Original Medicare, your next decision or choice to make is options 1 or 2. You can, again, buy a supplement plan known as Medigap, which what? Helps pay for some of those out-of-pocket costs, those deductibles we mentioned, that comes with Original Medicare. And it covers Parts A and B. And then you would have to buy a Part D, which is, again, required, per se, if you want to avoid penalties, to buy a standalone prescription drug plan. So that's part or option 1. Your second option, which is very popular, is to go with an Advantage plan. And an Advantage plan, what does it do? It replaces Original Medicare. Okay, it combines both Parts A and B and D. Now, there's some that do not include D, but for most, they have all 3, A, B, and D, combined together to make what they call a Part C or Advantage plan. Advantage plan also, in addition to all of that, adds additional benefits that Original Medicare does not cover. Let's go a little further about that. Option 1, what are the positives? Original Medicare plus a supplement plan plus a Part D or PDP plan for prescriptions. What are the positives? Medicare is the primary provider, and any doctor that accepts Medicare, you can go see them. There are no networks. A lot of people like that. You can determine exactly the amount of your coverage you want. The plans are standardized, and the most popular is a plan G and N are the most common. There's very little managed care, and there's less prior authorizations needed. And then you have to match up a standalone prescription drug to go with your specific medication needs. Option 1. What are the negatives? With Original Medicare and a supplement and a Part D, you have 3 premiums. You have to pay Part B, you have to pay for the supplement, and for the drug plan. And there are no dental or vision or extras with this option, except for medical conditions for your eye, which are covered. And there could be some issues for annual physicals depending on the doctor that you use. The positives for an Advantage plan. You pay only the Part B premium. For most areas, there are what they call zero premium plans to choose from. And Part D is included in that Advantage plan. And it's sometimes better than a standalone prescription drug plan. There's a fully annual physical is covered, and there's lots of extra benefits such as dental, vision, and over-the-counter or OTC allowances. What are the negatives? With all of that, you have to use networks with an Advantage plan. It replaces the original Medicare, so you can't just go to any doctor that you want. Even if you have a PDP plan, you have to check to make sure that they accept the plan. There are co-payments involved, and you will pay those co-payments until you reach what's called the maximum out-of-pocket cost, or MOOP. You may hear this term. There is managed care, so you have a primary care doctor who helps you with your care, and you have to get prior authorizations for certain procedures that you may need. It's a lot more hands-on. But the drug plan is usually solid, but it cannot be adjusted once you have that plan. So you compare the two, option 1 or 2. You may say, which one should I go for? Well, it all depends on you, and everybody's situation is different, right? So the general rule of thumb, if you use a lot of medical care throughout the year, then option 1. If you have many doctors and you go to different states to see those doctors, option 1. If you're, pretty healthy, and, very low amount of doctor visits per year, option 2. Or if you have a high importance on dental and vision care, and you like extra benefits, we mentioned earlier, over-the-counter allowances, and going to the local fitness centers and things along those lines, and other benefits, then option 2 would be the better. They also want to need to consider what they call GI, which is guaranteed issue states versus underwriting states. So depending on your health situation, that could be a issue. Guaranteed issue, no matter what your condition is, you get the policy. And that's both for supplemental plans and for Advantage, but depends on the state. They may do an underwriting before accepting you in the plan. And that plays a big deal with making changes during the year or down the road. Get into that a little bit more. For rules for changing plans. So once you get into a plan, the carriers expect you to stay with them the full year, but there are times when you may need to change. So just to have an idea when those changes can be done, as we're talking now here in the late August, October 15th, write that down as a big date. That begins what they call the annual enrollment period, and that's the huge deluge of enrollments and changes are done starting this October 15th, and that runs all the way through December 7th. And that sets you up for the plan you're going to have on January 1st of 2024. All right, so there's a lot going on now. So between now and December 7th, there's a lot of activity to make sure you have the best plan for next year. The second time you can change is what they call OEP, or open enrollment. That starts January 1st and runs all the way through March 31st. During that time, you can make a change. If you're unhappy with your plan, you can change from Advantage to Advantage, or you can go back to original Medicare and buy a supplement plan or prescription drug during that period of time, January through March. And if you're new to Medicare, you just turned 65, you can start anytime. Whatever month your date of birth is, that month you will start Medicare, and you can try out a supplement plan or an Advantage at that time during the year. The other times you can change your plan if you have a special condition, such as you changed employers, you moved to a new state, or you needed a better drug prescription plan, or you got help to pay for those medications, as another reason why you can change your plan. And then there's an annual follow-up, which, working with me or an independent advisor, you'll be able to look at all your options, see what your current plan is versus the new plans and changes that they have coming up, and then make the best decision for you. So with that, family, that is the basics of Medicare. From there, I hope we gave you food for thought. Again, if you have any questions or comments, you can definitely put them in the chat. I see there's a question, how much you pay for the hospital? And again, that depends in terms of the cost. You have what they call a maximum out-of-pocket cost, okay, which, depending on the plan you choose, the average is about $6,000. So you can pay up to, but no more than, say, $6,000 out of pocket, and then the plan will cover all of that. And that includes, again, inpatient stays to hospitals or outpatient costs for the doctors. So that varies from person to person, depending on how you're using the plan. So with that said, fam, I want to show you one other thing here. We can set up a meeting to speak specifically to your situation. It would be the best thing to find the best carrier for you. What you would need to make sure you have the best plan is to gather the list of all the medications that you may be taking, so we can check them in against all the different plans, and the list of doctors. So I'm going to put here, I'm going to stop sharing here for a moment, and I'm going to put here in the chat the link to my page. Okay, should have a copy of that, and you would click on that, and that'll take you to my, if you will, platform and page, where you'll be able to review on your own, okay, the plans that are in your area. These plans are national, so it's based upon from Medicare, based on your zip code, and you'll be able to see all the plans that are available to you in your area based on your zip code. From there, again, you could do a side-by-side comparison to look and see which one is most the advantages of all the different plans. All right. So with that, family, again, I don't see any more chat, anything in the chat. But if you do have a question, you can raise your hand or unmute yourself, and I'll be happy to answer your question there. All right. Well, that seems like we've covered. And again, these are educational seminars here that we're doing on a weekly basis here for the community, to make them aware of these options that I have, and this is very important. So please do tell a friend, a family, about these seminars, and if they need more education, you'll be able to reach me again here. My direct phone number, 610-771-1043. And I am available to discuss all of your options. So again, with that, family, I want to thank you for your time today. As we finished within a reasonable time, it's just 11:30. It's a short presentation, and I will see you at the next time, the next educational event that will be presented. And again, if you have some suggestions of topics you'd like me to cover, do contact me, let me know, and I'll be happy to present that to you as well. With that again, family, thank you again. Toda Rabbah, Shalom Uvraka, peace and blessing to you. Until the next time, take care.
Take care. Thank you.